Instrument pad display. Place the patient on the fluoroscopy examination table. Make sure the arm is fully backward. Expose the humeral head to the front of the acromion. Apply gentle traction to restore the length of the humerus. The top of the caliper is placed at the staple point. Select a location at least 2.5 centimeters proximal to the border of the olecranon fossa. Determine the length and diameter of the main nail. Determine the entry point. Use an electric drill to clamp the depth-limiting guide needle. Rotate and insert the guide needle until it reaches the bony surface. Use a protective sleeve. Pass the hollow ring drill through the protective sleeve. After drilling through the guide needle to the appropriate depth, remove hollow, tree-fine, protective sleeve and depth limit guide. Insert the protective sleeve and guide pin into the reduction rod. Insert the nickel titanium guide pin along the reset rod. Observe the position of the guide pin under X-ray. Using a sounder to measure the insertion depth of the guide pin, select the appropriate length of the main nail according to the depth. Use a soft drill to ream from small to large. The reaming diameter should be 1 millimeter larger than the nail. Assemble the main nail and the handle with a link bolt. Insert the main nail into the medullary cavity. If insertion is difficult, continue to enlarge the diameter of the medullary cavity until it is successfully inserted. Assembling the outer aiming arm with a 2.5 mm Kirschner wire through the hole marked 0 on the aiming arm indicates the insertion depth of the staple with a 2.5 mm Kirschner wire through the distal oblique hole of the forearm aiming arm. This Kirschner needle indicates the position of the ascending screw. Adjust the patient's arm. Insert the first yellow sleeve assembly into the hole. Insert the first yellow sleeve assembly. Insert the second sleeve assembly at the oblique position. Push the oblique casing down to the bone surface. Insert a 2.5 mm Kirschner wire through the inner sleeve. For temporary fixation, use the drill bit carefully to drill to the right position, and use the CB machine to assist in viewing the location. Remove the drill sleeve. Drive in a countersink drill. Make sure the 4.5 locking screw can sink into bone. Use a flathead side device to measure the length of the nail. Hold the 4.5 porous locking nail with the nailer. Push the inner core rod tightly. Insert the screw into the appropriate position through the protective sleeve. Make sure the final position of the screwdriver handle be perpendicular to the nail, pointed backward by arrow, and verify the position of the screw under X-ray. Finally, pull back the core rod to release the nailer. Install the other 4.5 porous locking screws in the same way. At least 3 4.5 locks need to be installed. Insert the blue drill sleeve assembly into the farmost oblique hole. Drill to the appropriate position. Use the CR machine to assist in viewing the drill position. Hold the 3.5 locking screw with a screwdriver. Pass through the protective sleeve and tighten it. The distal end of the short nail has 2 locking screws through the 2 aiming holes on both sides of the main aiming arm. Drill sounder and insert 2 locking screws in the distal end and lock them. Match the locking sleeve with the nailer. Insert it at the correct angle. Snap the locking sleeve at the end of the 4.5 porous locking screw. After the locking sleeve is installed, remove the aiming arm. Deflect the drill sleeve to a certain angle. Insert the built-in T-shaped drill sleeve. Insert the 2.8 drill sleeve into the outer sleeve. Use a drill to carefully drill to the appropriate position, and use the CB machine to assist in viewing the position. Be careful not to penetrate the joint surface. Select a suitable 3.5 mm locking screw. And with a 1.5 cow torque wrench to lock. Remove the handle. Select a suitable length of the tail cap and lock it. The end of the caudal cap should be 2 to 3 mm lower than the cartilage. To minimize the impact on joint mobility, insert the main nail and handle into the medullary cavity after assembling. Fix the distal aiming frame on the handle in turn. First, locate the distal platform hole. Platform position. Insert sleeve assembly. Use a drill to make a hole in the cortical bone. Then use a flat tip drill to clean the hole. Remove drill sleeve. Insert the positioning rod against the distal platform of the main nail. Use the limit block. Connect the positioning rod to the main body of the sight rod. Complete the platform positioning. Fix the distal side aiming frame. First, process the middle hole. With drill sleeve, drill bit drilling, make sure the hole position is accurate under X-ray. Retract the drill and drill sleeve. Insert an L-shaped temporary positioning rod. Complete the process of drilling and sounding in another hole position. Choose a suitable length of 3.5 locking screw. At least 2 distal locking screws should be fixed. After the distal locking screws are installed, remove the distal aiming frame. Replace it with the proximal aiming frame. Screw in the proximal compression hole screw through the proximal side with the drill sleeve drill bit to punch holes. Bathymeter measurement. Secure the locking screw to the pressure screw hole on the proximal aiming arm. Align the hole with the upper end of the nail slot. Screw the pressure rod into the handle. Through the pressure fit of the pressure rod and the hole, continue to push the pressure screw. Monitor the displacement of bone fragments under imaging until the required pressure is reached. Achieve the pressurization of the fracture line. The fixation method of the 4.5 hole near the main nail. Install according to the installation method of the above short nail 4.5 locking screw.